Yeah. So, I'm ready. Okay, so this is a review of the appendicular skeleton, this first part. And with the appendicular skeleton, we're going to look at the lower limb, or lower extremity, and then the upper extremity following that. The lower extremity, top bone, is going to be the os coxa, this bone, okay, and this is the articulation down the leg. We've got the os coxa, which articulates here in the lateral portion, the lateral anterior portion of it, with the head of the femur. We have the right femur. We have the patella that's going to sit on the surface here. All right, and then just below that we have the lower leg bones, the tibia and the fibula of the right leg, and then the foot that we're going to do here. And with each of the structures you're supposed to know for anatomy 2A summer session. All right, so the os coxa. On the os coxa there are three main portions to this bone. This bone is going to be made up of three portions. If you notice here, the posterior portion, the lower part here, is the ischium. This front anterior part, and this portion right here, is the pubis, and then the entire upper portion of this irregular bone would be the ilium. So on this bone, and to orient yourself on each of these bones, first you should orient yourself right and left, and orientation would require that you know, and determining right or left would require that you know the 6 different sides of it. So this is the pubis, it's anterior. The ischium is posterior. The acetabulum is lateral. And the medialmost portion that's posterior here is the articulation with the sacrum. So this os coxa, this right os coxa bone, is going to have 15 different things on it. Those things would include the ilium. The ilium has on it the anterior superior iliac spine, and notice that's just above the pubis, or pubic bone. So this is the ASIS, the anterior superior iliac spine. This is the anterior inferior iliac spine. Here's the pubis, the pubic ramus, superior crest, inferior crest, and this is the ischiopubic ramus, right above the obturator foramen. So here's the obturator foramen. Directly above the obturator foramen and lateral on this bone would be the acetabulum. The entire thing is the acetabulum. The impression that you see right here where the ligamentum teres attaches the fovea capitis of the femur, which is that opening right there, this opening, attaches through a ligament, the ligamentum teres, into the acetabular fossa, and down below it, the acetabular notch here. Okay, if we move posterior to that, we see right here on the bone, just above the ischium, the posterior superior iliac spine, the PSIS, posterior superior iliac spine, and the inferior iliac spine. So PSIS, PIIS right here. And then just below that you see this notch right here. That's the greater sciatic notch, the ischial spine right here, and the lesser sciatic notch and the ischial tuberosity below that. You also have on this bone the gluteal lines, but those aren't listed for you. We'll talk about those when we get to the muscles. So recap: the ASIS, anterior superior iliac spine, anterior inferior iliac spine, the pubis, superior pubic ramus or crest, inferior, the ischiopubic ramus. Here is the ischial spine, here's the ischial tuberosity. Then we have the obturator foramen just above the ischiopubic ramus, and the acetabulum, acetabular fossa, and acetabular notch above the obturator foramen. If we look posterior, we have the posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch is here, right there, the ischial spine is there, and the lesser sciatic notch and ischial tuberosity are here. That's the os coxa. Now we move to the femur. With the femur, we have also, upwards of 15 different things on it. First we orient it. This is the head of the femur, and therefore it's going to be pointing medial, and it's proximal on the bone. And it's always going to be opposite this large process, the greater trochanter. So this is medial and proximal, so we know distal and lateral here. And then we know that this smooth surface is for the patella, like so, and therefore it's anterior, and then posterior we have this landmark, the intercondylar notch or fossa, and the popliteal space right above that. So this is posterior, and therefore this has to be my right side femur. Okay, so with the femur, we need to know on that this is the head. Here's the anatomical neck around this point right here. That's the anatomical neck. And then we have the surgical neck here. Here on the other side, you can see a little bit better the greater trochanter and the lesser trochanter. And since now we're on the posterior side of the bone, we're looking at the intertrochanteric crest right there. The intertrochanteric line would be between these two structures, the lesser trochanter and greater trochanter on the anterior side. That's the line. Okay, so moving back to the posterior side, or let's review that real quick. Here's the head. This is the surgical neck around there. The anatomical neck. This is the surgical neck around here, right there. Then we have the greater trochanter, lesser trochanter there, and the intertrochanteric line, since this is an anterior view of this bone. And then we move to the other side and we have the intertrochanteric crest connecting the lesser trochanter and greater trochanter. We also have what I've mentioned already, this impression where the ligamentum teres will anchor the head of this bone into the acetabulum of the os coxa that we just talked about, and that's the fovea capitis, its attachment point. Okay, on the one last structure up here, we see right there on the intertrochanteric crest, posterior side, we see the gluteal tuberosity right there, structured for muscle attachment. Now, as we descend the bone into the diaphysis region, we're looking at a region that is going to have a line continuing down the shaft or diaphysis, and that's the linea aspera, which then terminates here into this triangular portion, right? So this triangular piece right there above the condyles right there, that triangular portion is the popliteal space. Down at the base of the popliteal space, we see the medial condyle, lateral condyle, and the intercondylar notch or intercondylar fossa right there. On the medial condyle, or right above the medial condyle, here we see the epicondyle, medial epicondyle, there's the lateral, and on the medial epicondyle we have a structure called the adductor tubercle. Anterior on this bone, you see right here, the smooth surface for the patella as well. So that's the femur. Okay, this is the patella, and what you guys need to know on the patella is that there is a pointed portion to it. Right there, that's the apex. That pointed portion will always point down the leg. The flattened part is always superior. So here's the apex of the patella. You set it onto the desktop, smooth side up. The rounded side goes down, and when you put it there, it falls to the right, and therefore this is the right patella with those other bones. Okay, now we have the tibia. The tibia has on it the femur condyles are going to articulate right here at the top. There's the proximal portion of this bone. So these are the supracondylar facets or fossa that are going to articulate with the head of the femur, with the condyles of the femur, like so. And joining these two bones together would be the cruciate ligaments, anterior and posterior cruciate, and that would be attached here at these two intercondylar eminences that we see there. This is an anterior view, so if we look at this whole bone as related to the 6 sides of it, this is anterior, and proximal, this tibial tuberosity, where the sesamoid bone that is your patella attaches at the knee. So this is anterior and proximal. So this is distal, and this is anterior, so this is posterior here. And more importantly, you see right here the medial malleolus, which is going to be your landmark for the distal portion of this bone. That's always going to be medial, as the name implies. So this bone has to be our right side if this is our inside medial ankle. And therefore, if we look at the structures one more time, we've got the supracondylar fossa for the condyles of the femur, the intercondylar eminences. We have the medial condyle, lateral condyle here. You have the tibial tuberosity right there for the attachment of the patellar ligament or tendon. And then you have down the shaft on this end, you'd have the medial malleolus and the articular surface for the lateral malleolus, which is the fibula. This bone, the fibula, is going to articulate here with it and there, right, and stabilize the lateral ankle, but it does not articulate, the fibula does not articulate with the femur above. It's just the tibia that articulates at the knee, right? So that's the right tibia. Continuing with the fibula, we have just basically the ends of it. We have the head of the fibula. This is the lateral malleolus, or the distal part of this bone. The head is always proximal. And then I look, and on this bone you can see a smooth surface here and a smooth surface down here. And these two surfaces that are smooth are articular surfaces that fit up against the lateral side of that bone. The fibula will articulate here with the lateral side of the tibia, and as it does so, you would create this cartilaginous joint between them. And that smooth surface there and there is going to always, therefore, be medial on this bone. The last thing I would use, other than the head and the distal part being the lateral malleolus and these smooth surfaces, would be this rounded surface. If you look at this bone on the distal part of it, this side goes straight up and down, this becomes rounded and comes out, and that rounded portion is always anterior on this bone, on the lower leg, and that's this lateral malleolus is oriented in that way, and therefore this is the right one, like I said, that articulates there with the right tibia. And then both of these bones will articulate with the talus of the foot, tarsal bone, and the medial malleolus and lateral malleolus will stabilize the ankle joint. This is seen here on this right foot. Here's the talus. Posterior to the talus is the calcaneus here. Right, so we've got talus, where we have articulating with the lower leg. The calcaneus is here, and this is the calcaneal tuberosity here, or the point of which the calcaneal tendon or Achilles tendon will attach. That process is going to stabilize the lower leg with regard to muscles. So we have talus, this entire bone. We have calcaneus, anterior to the talus, or distal to the talus, sorry. We have the navicular right there. And then we have a group of 4 bones that begin with a C. And those, since on this foot, we start numbering with the big toe, like we did in the hand, we start the numbering with the thumb. And since the big toe is medial, this is the first digit, second, third, fourth, and fifth. And therefore, this is the first cuneiform, second cuneiform, third cuneiform, also referred to as the medial, intermediate, and lateral cuneiforms. I prefer first, second, and third cuneiform bones that articulate distal to the navicular right there, and the talus here. The last of the sequence of 4 C bones, the cuneiform, first, second, and third, and then the cuboid articulates here with the 4th and 5th metatarsal. Each of these, as I stated, are the first, second, third, fourth, and 5th metatarsals. And here is the proximal and distal phalanx of the first phalange. Here's the proximal, middle, and distal of each of the next 4 digits, numbers 2, 3, 4, and 5, and that's the whole lower extremity.